Ringworms, the best treatment options. Ringworm, dermatophytosis, is a fungal infection which affects the skin, nails and scalp. It is a disease that can affect different areas of your body. Tinea is the medical name for ringworm. It isn't a life-threatening condition like psoriasis. It can also be easily treated with medications sold in pharmacies. This skin condition is particularly common among children. This condition is not that serious, unless it affects the scalp. There are different types of ringworm affecting each body part. However, there are natural ways to treat psoriasis and ringworm. It is a contagious disease and needs to be given utmost care. There are several different types of ringworm which include infections that affect the skin on your body. It can sometimes affect the scalp. The ringworm that affects the groin area is called Tinea cruris. The ringworm that affects the feet is called Tinea pedis. The symptoms vary depending on the type of ringworm, however the common symptoms include itchy, raised, red, scaly patches that may cause blistering and oozing. Symptoms of ringworm. To identify the type of ringworm on your body, it is important to identify the appearance of this skin condition. When it appears on the skin, it creates circular, reddish patches with slightly raised borders. As they grow larger, the centers of the affected areas become clear and give them a ring-like appearance. Tinea capitis, scalp. This type of ringworm begins with small lumps on the head which grow bigger in size and form a circular pattern. Tinea manus, hand. This ringworm affects the palms and also the spaces between the fingers. Tinea pedis, feet. This type may cause scaling in the spaces between the toes. It may cause thickening and scaling on the heels and soles as well. Tinea unguium, nail. Tinea unguium causes the fingernails and toenails to become thick, crumbly and yellow. Tinea cruris, groin. Tinea cruris, also known as jock itch, causes a itchy, chafed, reddish and sometimes painful rash in the groin area. Tinea corporis, body. This common type of ringworm produces flat, round and scaly spots on the skin. Tinea faciei, face. Tinea faciei affects the face by causing red, scaly patches on the skin. These common symptoms will only appear on your body after 4 to 10 days from initial exposure. The symptoms of scalp ringworm appear around 10 days after infection. Ringworm, on the skin. A ring-like red or silvery rash on your skin. Your skin will look red and irritated around the ring, but healthy inside. Scaly, itchy and inflamed skin. In more severe cases, the rings may multiply, grow in size and merge together. The rings may feel slightly raised and the skin underneath may be itchy. Blisters and pus-filled sores may form around the rings. The ring spreads outwards as it progresses. You can have one patch or several patches of ringworm, and in more serious cases, your skin may become raised and blistered. Fungal scalp infection, Tinea capitis. The symptoms of a fungal scalp infection include small patches of scaly skin on the scalp, which may be sore. Patchy hair loss. An itchy scalp. In more severe cases, small, pus-filled sores on the scalp. Crusting on the scalp. Bald patches. You need to do this until the patches are gone. Ringworm and other fungal infections. Most fungal infections can be diagnosed by your GP after examining your skin and asking whether you have other related symptoms. Treating infections. Washing areas of affected skin daily and drying thoroughly, paying particular attention to skin folds and between your toes. In the case of a groin, foot infection, changing your underwear, socks daily, because fungi can persist in flakes of skin. With a scalp infection, not sharing combs, hairbrushes or hats. Washing clothes, towels and bed linen frequently. Wearing loose-fitting clothes, preferably made of cotton or other natural materials. Side effects of terbinafine can include nausea, diarrhea, indigestion, rashes. Antifungal shampoo. Antifungal shampoo cannot cure scalp infections, but it can help to prevent the infection spreading and may speed up recovery. Home remedies. Coconut oil. The application of coconut oil for gray hair and treatment of other hair and scalp problems is well known. The healing properties found in coconut oil are extremely effective in treating ringworm infections.